would say if anyone is looking for into going into the DrPH program, do it. Especially if you're working in the public health field and you are adamant about being in leadership and you want something that's going to grow your skill sets and just have one more thing to add to your resume that's just going to give you that boost, and you're on the fence about it, do it. Also look into whether there's funding for that program, right? So a lot of programs have grant funding. So you want to make sure that if you're going into a program, cross your T's, dot your I's, make sure that you talk to someone to just figure out if there's funding available for that actual program as well. There's, I think, lots of information and resources out there that tells you like what DrPH programs or doctoral programs are fully funded.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Here's a quick message from today's show sponsor. Are you lost or confused in the application process? Are you a recent graduate and not sure how to navigate the job market? Take control of your career growth by accessing Public Health Hired's tools and methods that have helped hundreds of public health professionals advance quickly into higher paying jobs. To get started, check out the free job alerts on Instagram or download free key terms at www.publichealthhired.com. Use the exclusive code Hired100 in all caps to get $100 off the Hired Masterclass. Again, that code is Hired100. Keep calm and job hunt on. You got this. Now back to the episode. Today we have an active public health professional working to improve the health of communities through her work within the public health field and her passion for exploring the ways to develop and improve processes within the public health field through various avenues. She got a Bachelor's of Science in Health Services Administration at Keiser University, Tallahassee, while working in customer service management before getting her Master of Public Health at Florida State University and beginning her career within the public health field. She then got her Doctor of Public Health at the Florida Agricultural and Mechanical University. She was recently the Director of Strategic Initiatives at the Florida Department of Children and Families, and since graduation has relocated to the DMV area, where she has obtained her dream opportunity of working with the federal government as a Social Science Research Analyst for the Center for Medicare and Medicaid Services. We have Dr. Antraneise Jackson, DrPH, MPH. Welcome to the show.
Thank you.
Yeah, I'm glad to connect. I know that you said that you recently transitioned, and I'm glad that you still took the time to be on here, and I'm looking forward to hearing more of your story.
I am happy to be here, happy to see the work that you're actually doing. I took a look at your page, and I have actually been following you on Instagram for a while, and just looking at the different things that you share, encouraging public health graduates to keep talking about their story. So I'm happy to be here to help.
Awesome. Well, that's very affirmative, and makes me feel good. It always makes me feel good when someone that comes on the show says that they have been following me or they've been listening or anything like that. So I appreciate that a lot. So how are you doing, and how you've been coping during the pandemic?
I've been doing good, actually, despite, everyone else, or not, I wouldn't say everyone else, but lots of people experiencing different waves of things going on. I will say for anyone in public health, this has been an ideal time for us. This has been an eye-opener for our field and for just for how needed we are within the communities and helping in the spaces of healthcare. I don't think that we have ever gotten the recognition that we deserve, and now we are, and opportunities have opened up tremendously for our field. And for me, I think that has been, it's just been great. I have excelled despite all of everything that has gone on. I was able to complete my DrPH and also move up in management, and then also transition here to the DMV and obtain a federal government job. So I've been doing good.
Okay, well, I'm glad that you've been doing good. Definitely doing a lot during the pandemic, and I definitely agree that the pandemic has put a light on public health. I definitely still don't think that we have the respect that we deserve, but I'm glad that people like yourselves are out there showing what we can do, showing the importance of public health and continuing to do the good work. So I appreciate that. So tell us, how do you identify, and then tell us a little bit about your personal background.
How do I identify? So a strong Black woman, right? So I will say that I am the first in my family to graduate with a doctorate. So that was, a bit of a heavy lift, right? You have all these dreams and aspirations in life that you go for, and you say you're going to achieve them, but you don't really know how, and then it happens. So I am a single mother. I have an 8-year-old son. And so my biggest push was to make sure that I show him that anything is possible, right? No matter what area or field you want to go into, put everything into it and just don't give up. Just be determined, be disciplined, and get it done. And so I come from a large family, a big supportive family, who would push me on days where I had hard time getting it done, right? So they were my biggest support system also in helping me with my son while I was on this journey. So I am originally from Miami, Florida, moved to Tallahassee, Florida for school when I graduated from high school in 2007, stayed there till December of 2021. And in January 1st of 2022, I moved to the DMV area. So it has been a very exciting time, right? But at the same time, I'm a Florida girl through and through. So transitioning here was a little hard during the cold and the snow. We've never seen snow before, so it was different. But it has been great, though. I will say that it has been great.
Okay, well, that's awesome, and thank you for sharing that. I'm glad that you were able to have that support system throughout your entire journey. Being the first doctor in your family is also pretty awesome. And I'm guessing that the summers in the DMV area aren't going to be as hot as humid and as Florida is. So at least that's something to be thankful for.
Yeah, everyone tells me that, let's get really hot here. I'm like, I'm from Florida. So like, we're hot all year long. Like, I can deal with hot.
Yeah, that's one thing I don't miss about Florida summers is the humidity, as well as like I feel like in summertime it's hot in the morning and then raining in the afternoon. That's Florida. Yeah, that's Florida. Awesome. I appreciate you sharing that. So tell us, what does public health mean to you?
To me, what does public health mean to me? So public health to me is collaboration. It's ensuring that all populations have access to care regardless of their socioeconomic status, regardless of where they come from, who they are, what they believe in, that we have systems set up to ensure that everyone has not only equal, but equitable opportunity, right? And so looking into programs, looking into resources, identifying, where our affluent areas may have way more access to certain things than our maybe middle class or lower poverty areas. Being able to work into programs with all of the funding that we have, we have countless funding opportunities and things like that, looking into various programs and saying, how do we get that same level of access of care trickling down to all areas and not just one?
Yeah, that's absolutely important. And I think the pandemic has shown a lot of people outside of the public health realm what inequities are and how they are displayed when major changes or major like drastic health concerns are going around with the pandemic. And I think it just undergirds the importance of the work that we're doing and the importance of like focusing on equity and not so much equality. Because if we focus on the equity, we will get to equality at some point in time. But as we understand, the systems have been built for hundreds of years. So it's going to take some time and we got to put in that
down and rebuild them back up.
Right? Yep, exactly. Okay, so now getting into your collegiate experience here. You got your Bachelors of Science in Health Services Administration at Keiser University, Tallahassee. So what was the thought process getting this degree? Did you start off school with this degree?
No. So I will say that, everyone's journey is different when it comes to college, right? It took me 6 years to get my bachelor's. I started out at Florida A&M University when I came to when I went to Tallahassee. And as most college students do, you know, you enjoy college life, right? You know, I started out as a pharmacy major. I started my first semester taking 18 credit hours as a freshman. Did not know what that meant. That included pre-calculus, that included like chemistry, that intro to chemistry, all kinds of sciences that I was not cut out to do. So, but you know, in high school, they prepare you, but they don't prepare you for college life, right? So anytime I get a chance to talk to like my nephews and cousins and things like that, I tell them, what are you good at? What are you good at in school right now? Because if you're not good in science and you're not good in math, please don't think you're going to go to college and excel in those areas, or pick a major that is heavy in those areas and that you're going to do a great job. So I ended up not doing so great. I ended up having to transfer to Keiser because I was not doing so great. And in transferring and looking for where I could go, I found the health services administration field. I always knew I wanted to do something in healthcare. I always knew I wanted to be a doctor. Did not know what kind of doctor, because I know I didn't want to do individual bedside, all that. But I did know that I wanted to be Dr. Antraneise Jackson at some point in my life. And so the health services administration field kind of aligned with me wanting to be in management, me always having the desire to lead, and to you know, forge my own way in just the type of person that I am. So transferring to Keiser helped. I transferred there, and I think it was in 2010, January of 2010, and then I was finished with that degree by September of 2013. So from 2007 to 2013, I was working on my bachelor's. It took longer than normal, or longer than most people, or just as long as some people, right? But everybody's journey and path is different. As long as you don't give up and you find another avenue to get it done, it's all that matters.
Yep, absolutely. Super seniors and seniors all get the same degree at the end of the day. So to that point, going like looking back and reflecting on that, maybe someone is in their 5th year in undergrad right now and they're trying to complete it. What kind of advice do you have for them?
Take it one day at a time. I would just say, don't give up. Like, you've made it this far, you've taken all these classes, you've done all these things. Just take one more class. One more class will make you even much closer to that degree. And so that's what I had to take a step back and tell myself, and just to really look at, don't try to overload yourself. Don't try to do too much just because you want to get it done right away. Take 2 classes at a time if need be. It doesn't matter how long it takes, as long as you get it done. Because at the end of the day, that degree in your hand and walking across that stage is just amazing. This is an amazing feeling at every point. And I will tell anybody, when I see some people who get associates or bachelors and they're like, I'm not gonna walk across the stage, I just want to see my diploma. And I ask them, like, why? Like, you literally work this hard, you need to be celebrated. Walk across that up, do what you have to do.
Yeah, absolutely. And I definitely think not overloading yourself, not comparing yourself, just running your own race and doing it as life sees fit for you is important, and not losing that perspective. Okay, so you were a customer service representative before you started school at Iconic Group Incorporated, and then when you got into undergrad, you were a customer service assistant manager. And then a customer service manager. So tell me about all of that and how you came across all of that work.
Sure. So while in college, what started out as like a seasonal college temp job that a lot of college kids get over the summer, turned into me forging into a customer service management position years in the making. So it was great. We worked as it's called grad images. So they pretty much take photos of, or it was at the time, they've changed their name several times, but they pretty much take pictures of the graduations, right? And so we sold graduation pictures to colleges, college students, high school students, whoever had a graduation, we were there. And so in the customer service department, I basically started out as a seasonal customer service representative, basically taking phone calls, answering people's questions about packages, taking orders from them, things like that. From there, I was able to move into an assistant manager position just based on, the amount of hours I was putting in and the work that I was putting in and making a difference. And then when the opportunity came about, I was given the opportunity to become a customer service manager over the actual customer service department, where I was able to make some good strides and, help a lot of other college students get jobs and, kind of mentor some a little bit, as well as working on my master's degree. So that was the other great part about it, is I was able to do, support my son. He was born in 2013. So I was still working there. So support him while also, being able to be in a management position at such a young age, because I was pretty young, and a lot of the students that worked for me, they looked up to that because they were like, wow, if Antraneise can do it, I can do it too, or I can do more. And so I took that time to not only just work and go to school, but also kind of mentor and kind of talk to some of the students as well, and help them keep pushing, keep going forward, and just to be a listening ear to them as well.
Okay, yeah, that's awesome. And I think like just that progression and you saying like starting off as a seasonal worker and just answering phones, then going into the management and building probably a lot of leadership skills, as well as you said, like
Yes.
mentoring and being this person that people look up to at the organization and saying, oh, well, if she can do it, I can do it too. And I think that's a awesome perspective to have. And they are probably very, very fortunate to have had you as that type of leader at that point in time as well.
Thank you.
You're welcome. And you said you did this going into your master's as well, right?
I did it all the way up to the end of my master's, actually. So in my last semester of my master's is when, in February, I think it was, is when I actually got my my job in my break into the public health field. But I will say that this position, the customer service management position, like kind of helped forge me up to that, because you work with a lot of people, and in public health, you have to have customer service skills. You have to have people skills because you're working for the people. And so I talked to a lot of different people. I was able to, build up my skills in leadership and management, and it's transferable, right? All of those things are transferable skills. So I tell anyone, no matter where you're coming from or what you're doing, make sure that you're obtaining skills that you can transfer into any area. So whether it's leadership, whether it's management, customer service, all of those things are needed for any job or field that you're going into. You just have to know how to make sure that you describe it that way, and you're basically building on those skills.
Yeah, I absolutely agree with that. And I think a lot of people do get the questions and well, they ask the question, well, I don't really have public health experience, but it does relate to all these other rules, and as you said, the transferable skills, and just knowing how to share it is the perfect, is like what is perfect and what you should be taking away, because there's so much that you can take away from that. Were there any other takeaways that you had from your undergrad experience that you wanted to share with us?
Just that, it's no matter what you're going through or what you're experiencing, undergrad is the setup for the next step, right? So once you get past undergrad, it all seems to kind of flow a little bit more, because any other degree that you get past that, you're doing it for your passion. You're not doing it just to obtain a degree. You're doing it to be, it's more focused, it's narrowed, it's things that you want to learn about. It's more interesting, as opposed to undergrad. Of course, you have to take all these extracurricular courses, but just keep striving forward, because at the end of the day, there's greater on the other side of all of it.
Yeah, absolutely. So keep on striving, everyone. Okay, so you went on and got your Master's of Public Health at Florida State University, FSU. When did you know about public health as a thing to go and pursue a Master's of Public Health?
Yeah, so after my bachelor's, I took a year off, and I felt like I needed more. I was like, I knew I wanted to get a master's, I just did not know what I wanted to do with it. So I did. I took a year off. I researched. I kind of just looked around and seen what was out there. I kept seeing public health pop up, and so I'm like, all right, what's this about? And so I started researching and looking, and I looked into George Washington's program, and I looked into Florida State's program. And of course, we have to take that little thing called the GRE just to get in, right? Stressful test for me. Took it. It was I scored for George Washington, I think a few points lower than what I need to, but for Florida State, I was good. So I was like, whoever accepts me, that's where I'm going. And so Florida State was able to get accepted into their program, which is an amazing program with amazing leaders. Got accepted into their program and was able to be president of the Master's Student Association for public health, for the public health program. And it was just a great experience for me. Learned a lot, and gained a lot of friends that have become like family as well. So it has been, that was one of the best moves I couldn't say I did, was researching public health, finding out what it is, and then going to Florida State and really learning what it is.
Yeah, that's awesome. And I think it's good that you highlight that. And thankfully, a lot of schools are requiring the GRE for the MPH now, which is a blessing. But I'm glad that you highlighted that you took the GRE, which you believe is stressful, as well as you didn't get into the school that you ideally wanted to. Mm-hmm. But looking at your journey right now and looking at the story that we're going to get into a little bit later, it's just so important that people see, okay, just because this one little thing didn't happen for me doesn't mean I can't go on and be successful, quote unquote, in whoever's eyes. Success should be in your own eyes, just by the way.
Right.
But yeah, I think it's good that you highlighted that. Okay, so you got into your master's of public health. You're digging in and learning more about public health. You become a government analyst to strategy manager at Florida Health. So tell me more about that.
Sure. So like I said, in my last semester, spring semester of my master's program, I was able to obtain a position as a government analyst 2 in the medical quality assurance division at the Florida Department of Health. So this particular position was centered around the strategic plan for the division. So ensuring that the action plans that were set in place for the long-term goals, short-term goals, were being followed, they're being updated, working more collaboratively across the different areas of the division, the different bureaus of the division, to make sure that things were going as needed. So that position was a great entryway into the field. It helped me get my foot in the door, but it wasn't like my fulfilling. Like I was in it like 8 months, but it wasn't doing what I thought I was going to be, really doing. It was great, mind you. I will not say that it was a bad position. It just was not my niche. So I was able actually to obtain 8 months in, applied for a government analyst 2, which is a lateral move at the Agency for Healthcare Administration, which is Florida Medicaid. And I was able to get it. And it was in the Bureau of Medicaid Quality. And so that set me up for some real greatness. Met some amazing people who have forged the way for me, are still near and dear to my heart, mentors for me, and just have been truly like gems in my life.
That's awesome. That's awesome. And I'm glad that you're able to have that type of mentorship and leadership to look up to and help you while you navigated this weird and large field of public health. And,
yes.
And I think, like, to your point, you got into this initial role, but it just wasn't for you. And I think that happens a lot. And that's not to say that public health isn't for you, because there's just so many other things that you can do in public health, which is important to highlight. Before I talk about the next role that you had, going into your MPH and after like that gap year and the research that you did, was there any specific type of role that you were looking for at the beginning when you were going in, or were you just like kind of wide open to this public health field?
I was pretty much wide open. I just knew that I wanted a full-time role and I wanted to get my foot in the door. I'm a firm believer as if I get my foot in the door, I'm a hard worker. I'm going to make sure I believe in working smart, not hard, but also working with efficiency and process improvement. So if I get my foot in the door, I can pretty much maneuver myself where I see fit and see the growth. It wasn't, I knew I wanted to work in public health. I didn't know where. It wasn't until getting into the field and actually working in the field where I really, really, even when you're learning about it in your master's or your bachelor's, if you do the bachelor's program, even when learning about it, it's not until you work in the field where you really get a clear understanding of where you want to be and how you want to make that impact. And so honestly, once I got in, that's when I figured that out.
Yeah, absolutely, fair enough. And I think that as we know, like public health is just very elusive. More so it's going out into the public eye for people to understand a lot of things, but still then people are still thinking epidemiologists for the most part.
Yes.
so
It is
yeah.
so much more than that.
Absolutely. I think it's important as well, like just to, as you said, get those experiences and see what you wanted to do. Your goal is to get a full-time job in public health, and just figuring out what that would be for you is good insights as well. You also had an internship as a health education intern at Angels of Grace Community Wellness Center. So tell me a little bit about more about that.
Yes, so in your public health programs, and in all public health programs, I think they make you do a capstone, which is like an internship. Had to do it for my DrPH and had to do it for my MPH, and I was grateful enough to be able to do both of my internships with Angels of Grace Community Wellness Center. The owner and CEO of that is Dr. Mary Weaver. And she is also one of my mentors, and she is amazing. She has her DrPH as well. But basically, she opened up a wellness center out in a rural community out in Cairo, Georgia. And I was able to come in as kind of like a health education specialist type role, where I was able to help her plan and put on a health fair, which was super amazing. I was able to put together information about the county and how of resources were available, connected with a lot of different resources across that county and other counties to come to the health fair and bring resources to the community. We did a back to school drive where we gave back to school stuff for the kids. We had someone barbecue, we had a DJ. It was great because it allowed me. And then we also did smaller health fairs at different churches in the community too. So it was great because she allowed me to come in and basically just take over and just do it. And she was like, do what you can, help us get noticed. This is what we need to do. And she let me take it and run with it. And she's amazing. I can't say enough about how amazing she is. Even when I did my doctoral capstone with her, I did basically developed her strategic plan for her wellness center. And so it's just amazing the connections that you can make upon your journey in public health, and how they can guide you into different areas and just kind of help mold you into the person that you want to be without even knowing you're being molded, right? So, you're just being pushed into greatness.
Yeah. That's awesome. And as like I feel like you mentioned this, or like it's a theme in your story, that network, that community, those mentorship that you do get, probably informal and formal, was very pivotal in you understanding the field and getting the opportunities and things like that, which is awesome. And I think did you talk about, because you also added a community outreach coordinator role to this job? Was that what you spoke about as well?
Yeah, so I ended up not actually like leaving. Whenever she needed me, she called me. So I did my internships with her, but throughout that too, like whenever she needed help, I was there. So it was not far from the Tallahassee area. It's about 40-minute drive from the Tallahassee area. So whenever she needed help, I pretty much would reach out, do outreach for her, would go into, and it was all volunteer, but I had no problem doing it because listen, experience is experience. And if you can put that on your resume and it builds up your resume and skill sets while also helping you connect with others in the community, it's helpful. So I tell anyone, don't just look for paid experience, also look for volunteer experience too, because it all helps in the long run.
Yeah, that is so true. Especially people who might be struggling to find those paid opportunities, like reach out and say that you would do it as a volunteer. You never know what that would lead to, or as you said, the connections that you make. Yeah. So that's very, very important. And you won a Congressman Jason and Kelly Altmire, Endowment Award. So tell me more about winning that award. Yeah,
so that came as a shock, as in my role as the president of the Public Health Student Association, and also so as the president of the Student Association, I wanted us to get recognition. I wanted us to get noticed. I don't think there was, our class growing because the program was fairly new, but not a lot of people knew about the public health program at Florida State. So we put on a 5K run. We did we fed the homeless. We did a lot of different things within the community, just like trying to get our program name out there, and just trying to be more in the forefront. And so upon that, our assistant director and our director put me up for this award, which is basically highlighting a student who is doing just great public health work within the community. And I was shocked because I was just doing what I thought we needed to do. I wasn't looking for any recognition for it, but I just felt like it was something that needed to be done. And they highlighted me for it, which I am forever grateful for.
Okay, that's awesome. And it definitely seemed like you took that position as president and really ran with it and took on that leadership and responsibilities, which is awesome as well.
Thank you.
You're welcome. Were there any other takeaways that you had about your MPH program that you wanted to share?
I will say that my MPH program was in person. And I know that a lot of people try to move towards online programs, and I really wanted to do an online program because I felt like, how am I going to do this? How am I going to make this work? I have a child, I have to work full time, which I worked full time throughout all of my degrees. And so I was like, how am I going to make this work? But you will be surprised at how flexible your jobs can be if you let them know that you're trying to better yourself. And then the environments that you're working in if you have great leaders or great supervisors who want you to better yourself. And not only that, being in person, it helped really build relationships. It really helps. We became a family, honestly. Statistics, not my strong suit, but when we had our own lounge. When we got into that lounge and we all in there and everybody's like, we have a board up and we're writing it out and we're asking each other questions and we're explaining things to each other, it became that much easier to go through the program because you had people to lean on. You had people who were there to help support you. We pushed each other out the door, basically. We made sure that we all understood it. We all got it. We all were ready and equipped for any tests that came forward, that we were on time for any papers we had to do. We take time and we go into the library and study rooms and just hammer it down. Sometimes it's hard to do that in an online setting. But in the in-person setting, I just want to say that it has been great for both my master's and my doctoral program.
Yeah, and I'm glad you highlighted that too, because that was also a huge help for me during my MPH program. Was that my concentration was rather small. I mean, it's like 12 people in total, and we had all of the same homework for the most part on a lot of things. So we were able to come together and brainstorm and do the homework. And even if like we're overloaded in one part, someone might help you with this part of the homework and you help them with that part of the homework, and just like a collaborative learning. And that is literally what happens in real life public health. So I think like training yourself around that is also very important. So that's awesome that you highlighted that. Okay, earlier in the episode, you said that you knew that you wanted to be a doctor. I'm guessing, I don't know when in your life you had this like thought that you wanted to be a doctor, but I'm guessing that was not a thought about being a doctor of public health. So tell me more about that thought process for like wanting to become a doctor and then realizing like you could do like a doctor of public health, and then we get into your doctor of public health program.
So I knew I wanted to be a doctor. I didn't know what kind of doctor, because I knew that I didn't want to stick people with needles. I didn't want the bedside manner type thing. That's just not me. But I did know that I wanted to be called Dr. Antraneise Jackson. So the DrPH program, let's say how I came about this one. We were nearing our MPH, and one of my very good friends, Daphne, who went through the MPH program with me, we were like, I was like, this ain't it. Like, there's more. Like, I'm not sure if I want to stop. Like, I feel like I need to do more. So before I became president of the MPH program, there's, of course, it's a one-year term. There was a previous one, and every month, I think it was, we would put on seminars, and the public health seminars would feature someone who works in the public health field to come and talk about the work that they're doing how they got there, and just give the students an opportunity to connect and network. And so hadn't been to any of them. But then we got, the flyer for one that, and I'm going to talk about her too, because she's amazing and she's another one of my mentors. We got the flyer for Dr. Shamaria Robertson, who was previously the Deputy Secretary for Health for Florida, that she was coming. But at that time, she was just Bureau Chief for Chronic Disease at the Florida Department of Health. And so I was like, Daphne, we got to go to this. Like, we have to go. Like, we got to meet her. Like, I feel like she's someone we need to meet. And so Daphne was like, Antraneise. I was like, you're coming, we're going. So we made the time and we went, listened to her presentation, and we stalked her after. And she was in her she's literally finishing up her DrPH from Florida A&M University. And so I was like, we need to talk to her. We need to figure out what she did. We need to know, we need to know her. So afterwards we stalked her and literally talked to her for like an hour after. And this is in the evening, right? This is a 6 p.m. seminar. So it's like 8 o'clock in the evening on campus and we're talking to her. But she basically was the one who pushed us to do our DrPH. She was like, FAMU has a great program. This sets you up in so many different spaces. She actually did her MPH at FSU and came back to present and was telling us how she transitioned over into FAMU for her DrPH and did in 3.5 years. But she basically talked to us, mentored us, coached us, that, and told us, there's nothing you can't do. You can do this. You can fulfill this. This is something that is not hard. It just takes time. It's a 4-year program, but I did it in 3.5. That's all she had to take me. So, it took me 4. That's all she had to say. She did it with 2 kids and as a single mom and working full time. I was like, if she could do this, I can do this, right? Like, that's like motivation. And so literally that next day I was on, because I have family who work at FAMU. I was like, who do you know that works in the Institute of Public Health? And gratefully I was connected to Miss Gloria James and went and visited her, talked to her about the program. She got submitted all my information. Both the director and assistant director for the FSU program wrote letters of recommendation for me. And I was accepted and here I am now.
Okay, that's awesome. You see what a little stalking does, people?
Yes, that's why. So that's why I say, it's all about who you know or who you connect with, right? And so never miss those opportunities to talk to people, because you never know who you might be talking to. At that time, she was just the bureau. She was a bureau chief, just becoming bureau chief of chronic disease, to becoming the Deputy Secretary for Health, basically leading the public health throughout the whole COVID pandemic, leading all of the initiatives for that, working directly up under the Surgeon General, and just is an amazing person. And so we, connecting with her and not knowing who you're connecting with at the moment, because you don't know who they're going to become down the road and how they're going to help you in the long run. So it's just, I always tell people, never miss the opportunity to network and get to know people and just basically keep in touch.
Yeah, that's important, especially the part of like, you never know who they're going to become in the future and how that might be helpful to you, which is awesome. So yeah, kudos to you and Daphne for following up and doing that. That's awesome. Okay, so you got your Doctor of Public Health at FAMU, Florida Agricultural and Mechanical University. Was there any more to the thought process there, or did she sell you on doing the program?
Oh, she sold me.
Yeah.
She sold me and Miss James sold me. I went and visited and Miss James said, Antraneise, as long as you have everything that lines up with the requirements and you're good to go, you submit your stuff to me, give me a call and we will make sure you get in. And she was not lying. And then after she made sure I get in, she made sure I did everything I was supposed to get out. So she carried me through that program, or carried all of us through the program. Actually, she's amazing. She's very much so one of the people who helped hold that program up and help students get out of the program. But the program itself, I learned so much from Dr. Close, from Dr. Luque, Dr. Lopez. It's just so many different professors who are there who are amazing. The program is basically set up to, I wouldn't say it's not easy, but it's set up to make you think, make you critically think, make you learn, make you just a better public health professional. And it's a terminal degree, right? So that's the other part. I do not mind mentoring. I do not mind, I wouldn't mind teaching adjunct, but I knew that that's not the avenue that I really wanted to be in. I like working in the field. I like working in management. I love leadership. I love being able to see process improvement from point A to point B, operation side of things. I like the field work. So teaching, yes, I would like to do on the side, but it's not something that I knew as a PhD. That's not the avenue I wanted to go in. That's the other thing that drove me towards DrPH, because it's a professional degree, right? And so you take that and it's looked at as a leadership degree. It's looked at as management. And so in the DrPH, they teach you that. They teach you how to be a leader. They teach you management skills. They teach you how to, navigate strategic planning, strategic thinking, working in the various fields. So you learn about healthcare marketing, you learn about, maternal and child health, you learn about grant management, you learn about community work, working in the community with different providers, collaborating. It's so many different things that you learn within that DrPH program that builds from the MPH. So things that I learned in the MPH, it just helped to build further on top of those things to really become a master at, public health and what it is that we're doing, and why we're doing it and why it's so important, and looking at different ways and theories and things like that to think differently, right? Think differently about things. Think from a broader perspective, not a silo perspective, because in public health, you can't be siloed if you're going to get anything done. You got to work with everybody. And so that was the great part about the DrPH. That's the amazing part about the DrPH is it's just amazing. You learn so much, and the dissertation part is almost like hazing, right? But we get it done. So it's just to see myself from starting from spring, because I literally finished in May of 2017 with my master's, and I started in August of 2017 with my doctorate. So I only had the summer off. That was it. Went straight through. And to see how I, from January of 2015 to December of 2021, I have basically been in graduate school. And just to see where I am now, it's amazing, because you go through so much and the time flies by. So that's the other thing that I tell people. You can not do school, you can complain, you can say, I'm not going to do it, but what else are you going to do during the time, right? Time's going to pass by regardless. So that's 2 more classes that you could have done. That's 2 more things that you could have accomplished, That's 1 more thing that you could have crossed off your list. So why not just do it?
Yeah, absolutely. And I'm glad that you're mentioning all like those perspectives leading about the DrPH, that's like management leadership, that you don't mind teaching or mentorship and stuff like that, but that's not what you want to focus on. You want to be in the community. And I think that's a lot of the same things that I hear from people who are getting the DrPH. It is definitely very, very practical. I wanted to ask a question. This is not directly related to your DrPH, but in the intro, you said that you're in your dream job of working for like the federal government. When did that thought process of, this is what I wanted to work for, come up as a dream job opportunity?
I think after I got into state government, and just basically looking at, okay, the state, runs what's going on in the state, but it's a bigger picture, right? If you want to make influence, the government is where you're going to make the most influence, right? It takes time. It's not an immediate influence, but everything trickles down. And so the federal government puts out the precedents, the states carry them out, and then you have your local providers and communities that are actually putting in the work on the ground, right? And so federal government wise, I just knew that with that, it gives me the bigger scope, the bigger picture of going, being up at the top, making influence in bigger programs that are going to not just impact one state, but multiple states. These programs are being put into place in various areas, have the opportunity to put forth my thoughts and my work and influence, really large programs that are being, funded by our government, right? And so these are things that eventually you start seeing making a change or making differences in like Healthy People 2030 and all of these different things that are coming out, and the funding opportunities that come with them. You're a part of that, and so I've always wanted to be a part of the bigger picture, and the federal government is where the big picture is.
Okay, definitely makes sense. And yeah, as you said, like working in state government gave you that realization that there's a level above this that can,
Mhm.
that, as you said, sets a precedent for a lot of the work that is coming down to the state and local levels. Okay. So during your time in the DrPH, you were a government analyst too at the Agency for Healthcare Administration. You had quite a few different roles at the Agency for Healthcare Administration. So tell me about getting into this first role.
Sure. So that's the lateral move that I took from Florida Department of Health.
Okay.
And so that one was focused on performance improvement projects and quality initiatives, right? And so did the government analyst to work and was able to, there was some restructuring that occurred. A program manager position came open. And when that program manager position came open, I applied for it. And basically that was over all the performance improvement projects, all the quality initiatives, and things of that nature. So while the restructuring was occurring, we also received a new secretary over our agency, and she was very ambitious and she wanted a lot of things done and she wanted them done quickly. And so we had to basically set up various work groups that were centered around reducing potentially preventable hospital events and reducing adverse birth outcomes, as well as looking into the behavioral health realm of things also. And so this was 3 different work groups, had to basically develop them from the ground up, identify all of the various key players that we needed to have at the table outside of our managed care organizations, facilitate several meetings that occurred monthly across the state. So we weren't just having them in Tallahassee. We were driving to Jacksonville. We were driving to Fort Myers. We were flying to Broward. We were busy. So this is all pre-pandemic. And then pandemic hit, and we had to shut it all down. But that opportunity allowed me to really show, take on the role and really show like my leadership skills and how I can really do process improvement, facilitate, put together meetings, connect with various different stakeholders and organizations, because of course there was a lot of different players based on the topic or discussion that we were focused on. So connecting with all of those different and collaborating with all of those different organizations across the state. And then forging relationships, all right? So having to let them know what we're trying to do as an agency, how we're trying to benefit things, then get into the room with them and talk about different subgroups. How are we gonna make this happen? How are we gonna reduce these things? What is not working in the community? What can we do to make it work? Do we need to put out pilot programs? Do we need to look at different payment opportunities? What can we do? And then from there, in the work that I did, our great assistant secretary at the time, she's the secretary for the Department of Children and Families, but Siobhan Harris, she saw me for the great work that I was doing, and I was able to actually move into an agency for healthcare administrator role where it focused on, which was the next level up, focused on clinical compliance monitoring. And so looking at, in that space, at how our managed care plans were actually working. How are they making improvements for the Medicaid beneficiaries? How are they implementing the programs that they said they would within the contract? And then holding their feet to the fire, right? So when they're not doing what they're supposed to do, assessing liquidated damages, looking into technical assistance opportunities, talking to them about what they can do better. If they are doing things that are better, highlighting those things that they are doing better and sharing them across different health plans and say, hey, this health plan is doing this. Maybe you guys should look into that too. And then from there, I was poached from the Bureau of Medicaid Quality to go over to the Bureau of Medicaid Policy, where I was responsible for the managed care contracts. So that role was responsible for basically managing the managed care contract, writing the new managed care contract, overseeing the management of various different other contracts as well. So non-emergency transportation, I forget what the other 2 were called, but basically a broader role into the policy field. And then from there, I got poached to go to the Department of Children and Families because she left and went there, as well as another one of our great leaders, Erica Floyd Thomas, left and went there. And they were like, Antraneise, we need you. So I could never tell them no, because they are amazing Black women. They have forged their way. They have worked amazingly hard. They deserve the roles that they are in. They are go-getters. They are fighters. They have worked overnight, late nights, just making sure work gets done for the greater good of the residents of Florida. And so not only that, but highlighting and looking at talent that is great too, such as myself and others, and allowing us to flourish in the roles that they put us in and helping them to do that. And I just felt like it was a great honor that they even thought of me that much to want me on their teams to help make a difference and make an impact.
That's a good thing to be pushed into these organizations with the leaders that are like going from one place to another and saying, hey, we need you. So to that point, you mightn't have seen it at the time, but I guess reflecting on it now, what were those things that you did to make yourself indispensable and want them to have you, need to have you?
Yeah, so I tell anyone, right? We all go into jobs with different attitudes, but our attitude ultimately puts us in different positions. And so I'm always going to be a team player. I'm always going to be someone that my team can count on. I'm going to be someone that asks the hard questions, not be afraid to kind of push back a little bit on what we're trying to do, just to make sure that we're doing it. We're thinking smart, right? And we're thinking efficiently. But also, I'm never going to be that person to say, well, that's not my job. I've heard people say that. Or are they going to pay me more for this? Because then you're looked upon as, and of course, everyone wants to get paid more, but it comes with time and you have to think smart, right? And so it's everyone wants to get paid more for what they're doing, but at the end of the day, your work is going to speak for itself, right? And so eventually they're going to see the value in you and they're going to promote based on, the work that you're putting in. So I say work hard, but also work smart. Be a team player. Don't always look for reimbursement right away first for immediate action, but put in the work and see how over time how you're being valued. If you're not being valued, though, I do say there's relentless opportunities out there. Please know your worth. Please know your worth. Don't stay somewhere and complain, but go somewhere where you are valued and appreciated and you have growth. I also say you should be looking to grow within your field every 2 to 3 years. There should be some growth opportunity. You should be, if that's what you want, that if that's something that you're striving for, you should be looking to grow. If you aren't growing and you aren't happy and you feel stagnant and you feel like you're not being fulfilling, it's time for you to look for new opportunities. There's so many opportunities out there, regardless of, what field you are in. But if you are in public health, there's no reason why you should be stagnant or feeling like you're not being fulfilled. When there's remote work, there's work in various organizations where I see it so often where they don't have enough people to do the jobs that are needed, especially in public health. Like the number of resources that are needed, they have the money to put people there, they just don't have the people. So I would say just make sure that you are putting your best self out there, working really hard, working smart, also taking on more. Don't just do what you're required to do, do more. Put yourself out there to network into other areas. If you're able to help on other projects, put yourself out there to help on those other projects, because you never know where that might lead you as well. And you might end up in a passion that you didn't know was your passion.
Yeah, that's absolutely great advice. So I appreciate you sharing that with us all.
Of course.
Yeah. So during your time during your DrPH as well, you were on the DEI Council for Shared Governance Council members at the Tallahassee Memorial Healthcare. So how did you get onto that, and what were your responsibilities there?
That came randomly into my inbox one day. Someone was like, "Hey, so they're looking for someone to join their governance organization or council, I mean, and I think you'd be great at it." And so I was like, all right, sure. So I sent the email over to the guy and he called and he was like, "Hey, I'm going to do this. This is like an informal interview." I was like, "An informal interview? I wasn't trying to interview for anything. I have enough on my plate, but sure. What do you want to talk about?" And so we talked briefly, and then they asked me to be on the council. And basically, it was just a council of them pulling together not only individuals from the Tallahassee Memorial Healthcare that worked there, but they needed individuals from outside of the actual organization to kind of help build their diversity, equity, and inclusion within their actual hospital, and then also branch out into the community to see how they can help in that space and get community members to know they want to be more involved and they want to be more inclusive and partnering with some of the community initiatives that might be out there that they are able to either help with funding, resources, or put their name on something, or just provide support too. So it was a great experience to sit on and kind of offer feedback and things like that. I would say that it was a little bit more work than I needed it to be. So that's another thing I will say: commit to things, but make sure that you're committing to what you can do. Don't stretch yourself too thin. Sometimes we can do that, saying yes to everything. And that's how another council came up too. I think it's the North Florida. I forget what it's called, the North Florida Council. It was another, they were FQHC, basically a federally qualified health center, and they also had a council. And I got an inbox, well, not inbox, but an email asking would I be willing to sit on that council as well, which did not meet as much while I was there. This was in like my last year in Tallahassee. But it was also something similar about that too. So you never know, people are watching you and seeing, you know, the work that you're doing, and also like the collaboration that I was doing, right? So working across different sectors and in Medicaid, and just collaborating with various different organizations across the state of Florida helped tremendously. I will say that working on the birth outcome stuff and working across, working with the Florida Perinatal Quality Collaborative, that's how I was able to get one of my committee members, Dr. William Sapperfield, because I worked with him at Medicaid, and he's amazing in the maternal health space. And that was my dissertation on maternal health, not reducing, but looking at the patient-provider relationship and how that ties into women experiencing a maternal morbidity. And he's an expert in that. So to be able to have someone like him on my committee, I was like, it was great being able to work and then have those connections, and then being able to talk to them about it, and then asking him would he be on my committee, and he's saying yes, because I've already worked with him and he knows my work.
Okay, and just for those who might know what a DrPH committee or committee member, what does that play into everything? And then what was your dissertation more about, or what did you find out from doing this work?
Yeah, so of course, when you do your doctoral program and you pick a dissertation or a thesis, depending on what your program specifies, mine at Florida A&M University, it was a dissertation. You basically have to conduct a study. And because my concentration was behavioral sciences and health education, we had to do primary data. So primary data basically means that you have to come up with a study, you have to get your own data, you have to analyze your own data, and you have to present on that, as opposed to the epidemiology and biostatistics concentration. They just basically have to pull a data set and analyze that data. It's a little bit different. It's a little bit easier for them too. So with that being said, you get to choose a committee. Basically, you get your committee chair, who's basically your main advisor within the program. And then you get 3 additional chairs of committee members that's within the actual school. And then you get 1 outside committee member. And so I was able to identify my 4 from the school. And then you're able to choose 1 expert who also has to be, of course, qualified. You can't just pick anybody. They have to have a doctorate. They have to have had some experience within the field. There's some credentials that have to be tied to that. And so I was able to, I knew what I wanted to do, which was based on maternal health. Maternal health, I will say, is my passion. I'm very passionate about, that's the ultimate field that I want to work in. Is, looking at maternal health, looking at all of the disparities within the maternal health field, right? The moms that are dying at, drastic rates for preventable measures that are in play that could have been done, just because they either was not heard or, treatment was not enacted in time. I've had individuals who have told me stories that just should not have occurred. I've got a best friend whose story is just, it's unbelievable. And so we have a fragmented health system, right? And a fragmented health system for women in a country that is one of the highest countries in the world, dying at alarming rates. And so I wanted to make sure that I did a study that focused on what does that mean for their patient-provider relationship, right? How was your experience with your provider? How was your experience with the hospital that you gave birth at? Was there signs or things that occurred that, you was alarming to you, or you felt like the doctor did not listen? And then based on that, did you experience a maternal morbidity? Well, there was some significance in some of the information that I retrieved. At first I did a quantitative study survey, which went out to all women of Florida that could fill out. I received about 175 responses from that. Based on that, the women who opted into actually doing an actual interview with me, I interviewed about 15 women, I think it was, and just basically talk through their story with them and kind of ask them just some key questions of, what their experience was like and things like that. And it was alarming. It definitely requires much more research into the field. A lot of women experience things where, how it just opened up into how our healthcare field has come from such a long ways, to where you have the one doctor, you get so much time with your one doctor, as opposed to now that it feels like they're running like, they honestly not feels like, they are running like a business. Like, you, depending on what day you come, you're going to see a different doctor. They probably are looking at your chart. They don't really know you personally. There's no empathy there. There's just a lot going on. And so trying to get back to giving women the care that they need, listening to women, because some of them felt like they were not heard, that some of their situations could have been avoided, and really allowing them to have the resources and the treatment opportunities and being given those things without having to beg for them, or having to fuss about it, or having to say, hey, something is wrong, or being sent home just to go back to the hospital to say, had you waited a little bit longer, he would have died.
Yeah, well, thank you for sharing that. And yeah, it continues to be a tragedy, considering that we spend 20% of our GDP in this country on healthcare.
Yes.
and we have like the worst maternal mortality rates for rich countries. It's especially for Black mothers. It's very tough, very traumatic in a lot of ways. So thank you for doing that research. People out there continue to do the research, but also let's get some more implementation and ways to fix the system that is truly broken. Okay, so before I ask you if you have other takeaways from your DrPH program, so you said that you were a single mother. Well, you are a single mother, and you worked full-time throughout both your Masters of Public Health and your DrPH. How did you do
that? Showed up every day. It's amazing, because my friends will be like, oh my God, introduce your superwoman. I'm like, no, I just have to do this. Like, I have a child to raise, so I don't have a choice. Sometimes he went to class with me. A lot of them saw him, they knew him, especially in the master's program. They'd be like, oh, Christian. But the help and support of my family, I will not take that for granted at all. Like, I have the best family in the world. Like, they looked out for me. If I needed them to pick him up, I could call cousins, I can call aunts, I could call anyone, and they would pick him up. They keep him for me if I had to do any special projects, or if I just needed a break just to get work done. His grandparents, like, it was truly helpful to have a great support system. Like, and that's with just not even with just having a child, but in general, if you have a support system, they push you even more. In a good support system with a good environment, they'll push you even more to get things done, even if you don't have children. Just because they want to see you excel, right? They want to see, it's all about who you surround yourself with. Even with friends, like, my friends would offer to keep him if they needed to. And everyone just wanted to see me grow. They wanted to see me prosper. They wanted to see me just get one more thing behind my belt. And so I'm forever grateful for that and for them.
Shout out to family and friends, and like, I guess also shout out to you and yourself for pushing through, taking it on day by day, as well as wanting better for your life, and not like creating barriers to that, but just working it through and figuring it out. And thankfully you had the support, and I'm guessing continue to have that support, in all the great things that you do. So I appreciate you sharing that.
Thank you.
You're most welcome. And shout out to Christian.
Yes, he's been a trooper, and he'd always say, Mommy, how much longer till you're Dr. Antraneise Jackson? So then when I did become, he would tell everybody, no, you have to call my mommy, Dr. Antraneise Jackson. And so we think they're not paying attention, but they are. And so that's one of the biggest pushes that I had. Like I had to get it done. If it wasn't for me, but for him.
Okay, that's awesome. That's awesome. Shout out to you and him and both of you. Okay, so what other takeaways or advice do you have for DrPH people?
I would say if anyone is looking for into going into the DrPH program, do it. Especially if you're working in the public health field and you are adamant about being in leadership and you want something that's going to grow your skill sets and just have one more thing to add to your resume that's just going to give you that boost, and you're on the fence about it, do it. Also look into whether there's funding for that program, right? So a lot of programs have grant funding. So you want to make sure that if you're going into a program, cross your T's, dot your I's, make sure that you talk to someone to just figure out if there's funding available for that actual program as well. There's, I think, lots of information and resources out there that tells you like what DrPH programs or doctoral programs are fully funded. I would also say too that it's just an amazing experience. It's a tough experience. I will not cast a shadow on that at all. You will have days where you will cry. You will have days where you will break down. You will have days where you will want to quit. But it's 4 years. What are you doing within those 4 years anyway? That's 4 years that you could have that by the end of those 4 years, you can either have a doctoral degree or you cannot. So it's just push yourself if you can. If you have the capacity to do so, just do it.
Yeah. Awesome. Great advice there. Okay, so you graduated from your DrPH program and you became Director of Strategic Initiatives at the Florida Department of Children and Families. So how did you come across that and what did you do in it?
Yes, so that's one of the positions where I got poached, and that's before I graduated. That was actually in July of last year. And those wonderful, amazing women that went over to the Department of Children and Families called and was like, hey, we need some help. And so being that I'm the type of person who is focused on process improvement, strategic thinking, innovative thinking of ways that we can do things differently, thinking of ways that we can streamline processes, streamline programs to really make sure that we're getting what we need and utilizing the best resources possible. And so I interviewed and I came over and I was the Director of Strategic Initiatives within the Substance Abuse and Mental Health Program Office at the Department of Children and Families. It was an amazing experience. Of course, it was only 6 months, but it was a different avenue. And so I have worked at the Department of Health, I have worked at the Agency for Healthcare Administration within Florida, and I have worked at the Department of Children and Families. And while working at the Florida Medicaid Agency, I had already been working with those different agencies already in a lot of the work that I was already doing. But then moving over into the Department of Children and Families and actually doing the work in there, behavioral health, I have a newfound passion for that as well, because the work that gets put into that side of things too is just amazing. And so everybody's always like, public health, what is public health? Public health is everything. It is not just one thing, it is everything. You go towards behavioral health, that's public health, because this is access to resources, access to needs. Are people getting the mental health resources and needs that they have that are needed? Are there enough of those resources in communities? If there are, how's the access to those resources within those communities? Are they able to get them immediately, or is there wait lists? Like what does the system of care look like for individuals within various communities? And so, it's just been amazing to see from different perspectives how the system of care works and how public health ties into all of that, and how we get people the access that they need to get the resources that they need for overall health, right? So we're not just talking about physical health, we're talking about mental health, emotional health, psychological health. Like all of that ties into all of these different avenues, all these different things. And it's all about built environments. Like what does their environment look like? So if you want to talk about Department of Transportation, that's public health too. Like public health is so broad and so amazing. And that's the other thing that drew me to it, is because I'm not stuck in a box. I'm not doing one thing. I can go anywhere and do public health. And I can do it from an operations standpoint. I can do it from just a basically a health standpoint. I can do it from a programmatic standpoint, evaluation standpoint, and I'm still in public health. I'm never leaving the field. I'm never told that once I get out of this job that I'm no longer doing public health, because I'm always doing public health.
Yeah, that's big facts, and I appreciate you sharing that for sure.
Yes.
And you mentioned quite a few times process improvements throughout this episode. So tell us a little bit what that is, or maybe give us like a simple example.
Yeah, so when we talk about strategic planning, that's process improvement, right? So you're taking a look at, I'm big on looking at the long term. Of course, we always get stuck in the day-to-day. Everyone's stuck in the day-to-day, but the great part about leadership is you're supposed to pull yourself out the weeds and really look at the overall perspective of how things are running and how we can improve processes and make sure that they are more efficient. And so that's where that program management, program evaluation comes in public health, because we're really taking a step back and looking at the overall of how this program is working and how we are actually improving outcomes. What are our outcome measures of this? Are we making an impact? Are we not making an impact? Are we standing still? If we are, what process improvement measures can we put in place, or what action steps can we put in place to make sure that we are attaining our goals or overachieving our goals, or reworking them, retooling them? And so that's where I come into place, because I'm big on operations and big on that process improvement, meaning I'm going to come in and I'm going to take a look at something. I'm going to say, why are we doing that? It doesn't make sense to me. It probably doesn't make sense to like 5 more people. And so, I'm going to ask those hard questions. I'm going to ask those questions of, how does this get us to our outcomes? How does this get us to what we're trying to achieve? How are we measuring things? What is the data telling us in this? How are we measuring things to get to that point? When are we expecting to see these outcomes come into place at a certain point in time for this program? And then have we talked to people within the community? Have we talked to the actual people who this is going to affect? And have we gotten their input in this? And how do they think that this is going to work? Because if they don't think this is going to work, how are we expecting it to work? We're coming from up here trying to help people down here, and if they don't believe it's going to work, and so making sure that we're getting the input that we need, while also retooling, reworking, constantly looking at the measures, constantly looking at the data to see what's actually making a change and making an impact.
Love that. And that was a great explanation. And I think it's very important to have more people like you at tables and in discussions asking those tough questions, because as you can see to this day in 2022, a lot of things have been going on without being questioned, and it has left us in the same place with the whole host of inequities that go around, and we need people to
exactly
think.
And so when you ask me the question about what would I tell people who are trying to grow and look, and you have to be able to ask those tough questions. You can't just sit at the table and be silent. You have to be able to provide input, provide feedback, provide some knowledge to that table and your skill sets to be able to see that, okay, they're asking some really good questions, or they're really, challenging us in this space. And then when you ask those questions, come with solutions. Don't just point out all the problems, but come with ways that you think can make an impact or make a difference in this program, and how, even if they don't adopt that, keep looking. It's something that's going to eventually come up, or something that is going to eventually stick. But you want to make sure that you're being heard in that room constantly.
Absolutely. And I also like the point of view, like bringing it back to the community and saying, is this something that you think is important, or is this something that's going to impact, or how is it going to impact you? And asking them that question, and like asking them for their input, because that too often is not done, or not done well enough. So yes. Awesome. Okay. So you currently are in your dream role. I'm guessing that could also evolve, as you said, you have passions in maternal and child health, in behavioral health, but right now you're in one of your dream roles as a Social Science Research Analyst for the Center for Medicare and Medicaid Services within the Centers for Medicare and Medicaid Innovation. Mm-hmm. So how do you come across this role, and what do you do?
Applying for a ton of jobs on USA Jobs. And one finally coming through. Yes, but in that job journey, right, I was more strategic. I wasn't just looking for anything. I was looking for things that I was going to like doing or want to do. Agencies that I have worked with previously in the state roles that I know are doing work that I would be interested in. And so just so happened that I got an interview with the Center for Medicare and Medicaid Innovation and was afforded the opportunity to work as a social science research analyst in their division of advanced primary care, looking at different payment models and how that affects, reduces those, of course, adverse hospital events and increases primary care, individuals going to primary care and having access to primary care, while also reducing costs in that space. So it is one of the stepping stones into it. Of course, my growth is exponential, so I don't put a cap on it, but I just pray that the area that I'm in will allow me to grow and continue to prosper and to continue to gain leadership, while also influencing others to do the same and helping others up and reaching back down to help others up along the way.
Okay, awesome. Well, thank you for giving a very succinct description of what you do. And just to give people perspective, how many applications do you think you did before landing this job?
A lot.
More than 50?
Yeah. I will say that I started applying for jobs in about May-ish of last year, because I knew I wanted to move. I knew when I finished my doctoral program, I wanted to be out of Tallahassee area. So just so happened, I think I started interviewing with this team around November-ish. Did not get my job till I moved here, which was fine. But at the same time, it just takes time. Don't give up. So I was one of those ones, and I tell my friends to tell you all the time, like, I put in 5 applications a day if I had to. I had it down to a system where it's all on my phone. I'm on my phone and I put in 5 applications on USA Jobs or on LinkedIn or wherever else. Just don't put your eggs across all baskets. Of course, apply to things that you will be interested in, but know that it's just going to take time. It's not going to be an immediate thing. For some people, it might take longer, but once you get into that job, you will feel so much better. Once it finally comes about. But it's just, it was not an immediate thing. And I had previously applied for jobs on USA Jobs and before I even started to want to move here, and it just, nothing stuck until now. So when it's your time, it's your time, but you just got to be humble and trust the process.
Yeah. Okay. Well, thank you for sharing that perspective. Very, very important as well. So before I move you on to the last section of the show, I'd like to ask you, where would you like to see yourself in the future?
In the future, I really would love to definitely be in a leadership role within federal government. I wouldn't say too high profile. I don't like to be out in the open, but definitely someone who's able to make the decisions and make the movements on some of these models and programs that are being put out there that are making a difference, especially in the maternal health space. Maternal health, behavioral health, those areas I would be ecstatic about, while also opening up a consulting firm at some point, right? So I do want to have my own business. That is something that I have long strived for and have been slowly putting in the work to do. Of course, it's hard to do that while in school. And so now it's just trying to find my niche to get into doing it. But it's definitely something that eventually I want to be able to do on my own.
Awesome. Well, we look forward to seeing how that all unfolds, and definitely we'll be keeping close tabs on you and your job progression as it goes on. And I also wanted to highlight the point of, like, you were saying that you want to be in this leadership role, and leadership started for you as a customer service assistant manager back in undergrad, which I think is important for people to know, is like that one thing that had not really related to public health, but bringing that up. Yep. So, and then throughout the entire theme of your story is a lot of that leadership too. So that's awesome. Okay. So moving on to the Furious 5, the 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Research. Find out the areas that you really would like to work in, and then connect with people, right? So reach out to individuals who have completed it, reach out to individuals that are working in the field, write down 5 good questions that's going to help you answer, make your decision, and ask them those questions. You'll be surprised what how people are willing to answer questions. I've had people inbox me on LinkedIn just asking me what made me pursue my DrPH or my MPH and what led me to that, and have thanked me for just taking the time to do that. But a lot of people are willing to answer those questions. Don't be afraid to reach out to people or network and just ask the questions that you have that are just going to be the driving factor in helping you make your decision.
That's great advice, especially with the accessibility of people on LinkedIn and things like that. Okay, number 2, if you were talking to someone wanting to get into your position, what advice would you give them?
Be diverse, right? So if you have the opportunity to collaborate across different sectors within the current job that you may have, make sure that you're able to do that while also highlighting that in your resume. Also make sure that you highlight in your resume areas of work that you have put work into, right? So don't box yourself into that one job that you were hired to do. Put yourself outside of that, make sure that you're not hindering yourself from your own growth. You have to be able to highlight your greatness. And sometimes that takes you working a little bit harder or doing a little bit more to be recognized, but that's all right, because eventually your recognition and your value will be seen, and you will be happy about that.
Yeah, absolutely love that. Number 3, what's something you're working on improving in your life right now?
Giving myself space and grace, not saying yes to everything. I have always been that strong friend, that friend who everyone calls on, hey, I need help with this, or can you do this, or can you do that? But really taking a step back to look at what I need for me. In those moments, we kind of forget about ourselves and forget about what's needed for ourselves. So take the time to really focus on you, whether that's get you a therapist, whether that's taking self-care days, whatever it needs. If you don't allow yourself to recharge, you're no good for anybody or anything that you're doing. And so I've had to come to that realization and take a long, hard look in the mirror at myself and, like what that means for me, and how I don't want to always be a strong friend, but someone who is vulnerable as well. And so, that takes a lot to look into. So make sure you're taking care of self while also doing all these great things in life. You are important. Of course, yes, the accolades and the things are great things for you, but at the end of the day, your happiness is what means the most.
Yeah, absolutely. And I think especially in public health, that is something that people need to hear and continually need to hear to center that in everything that they're doing. Okay. Number 4, professionally, do you recommend anything?
I'm gonna keep saying this till I'm blue in the face. Networking. Networking. Put yourself out there professionally to where no matter what people see, they see greatness in you. No matter what people say about you, they have nothing but great things to say about you. Even if someone has something bad to say about you, the impression that you have already set out there and put on people is going to overshadow anything that anyone has to say about anything bad that anyone has to say about you. Your reputation is everything. So first impressions are everything. Put a smile on your face. I don't care what kind of day you're having. I don't care, what someone just said to you. No matter who you interact with, that first impression of you should be a smile on your face and a warm, welcoming attitude, because you don't know who you're going to meet. You don't know who they might be for you in the future. And so I always try to have a big smile no matter what kind of day that I'm having, and interacting with other people, and just give your best self. And don't forget to reach back for others, because that's important too, and mentor and help others. Don't look forward to do it for money or anything like that, just to pull someone else up, because sometimes people just need to hear that.
Yeah, yep, great advice, love it. And number 5, last but not least, where can people connect with you?
LinkedIn. So I'm on LinkedIn. You can look me up, Antraneise Jackson. I am there. If you have questions, you can inbox me. I'm always willing and happy to help others who are on the fence, or who just need some questions answered, or who needs anything. I have friends to this day. Everyone asks me for resume advice, for job interview advice. The one thing that I will say that I tell everyone is, we all bleed red, right? So everyone's always intimidated by interviews and things like that. But I'm like, what makes them different from you? Because they're holding a title. At the end of the day, you know what you know, and you need to be confident in what you know. And your confidence exudes just and overshadows anything else. And so if they know that you're confident in who you are and what you're bringing to the table, that makes them that much more confident in hiring you or wanting to put you in a position. So don't get in a room with people and start to just like cower, because that's ultimately going to make them think, I don't know about them. But if you walk into that room and you own that room and you own who you are, you own your knowledge, your skill sets, your abilities, you know what you can do, and you speak to that to the best of your abilities, you're 9 times out of 10, they're either going to like you. There has to be somebody who has to come out, who's going to come after you and just have to blow it out the water. Because at the end of the day, no matter what you do, your skills are transferable, right? And so I've worked in various areas, and there's areas that you're not even going to work in. And even not working in those areas, your skills are transferable. So yes, you can get in that room, you can say, I have not done this, but I've done this, 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 and this. And I know that if I can accomplish and master these things, I can get this with no problem, right? And so I think people get intimidated by interviews, people get intimidated by titles, and they just forget that that's just another human being sitting across the table from you or sitting across that computer screen from you. The worst they can tell you is no. How many times have we heard no?
A lot.
Right. So, I mean, yes, that's a bummer, but at the end of the day, that's not going to be a reason why I bum out on an interview or I feel like someone else is the upper echelon for me. I'm never going to feel that way, because we all bleed the same way. We all can come down with the same ailments, and our bodies are impacted similarly. So that's just how I view things.
Yeah, great perspective, and definitely connect with Dr. Antraneise. I'll be sure to put her information in the description and the show notes. But thank you so much for coming on, sharing your insights. It really was a joy chatting with you today.
Thank you for having me, and wishing you all the best of luck.
Thank you. I appreciate that. So some housekeeping items, everyone. Thank you so much for watching or listening to this. If you're not subscribed as yet, definitely subscribe, leave a 5-star review. If you're watching it on YouTube, leave a like, and just share this episode with a friend so that they can better navigate their public health careers. Greatly appreciate it. If you'd like to join the Discord group that I've created, go to thephmillennial.com/join and connect and chat there. Leave your intro in the intro section. Look forward to seeing you all there. And it's free, just in case people were wondering. So see you all there. Peace, everyone.